My name is George Wong, and I'm a union member and pharmacy technician at Kaiser San Francisco Inpatient Pharmacy. A couple of years ago, under SEIU, under the leadership of Andy Stern, filed a trusteeship against, at that time, the leadership of SEIU UHW, which at that time was a very progressive union and very politically powerful. So the dispute was about 65,000 long-term care workers that were being forced to move out of our union into another union, and we wanted a democratic vote. And so for whatever reasons, they came up with a trumped-up excuse to trust the leadership out so they could take over. The real intent was to corporatize unions and to bargain all the contracts centrally, in Washington D.C., and take the bargaining away from union members at the local level, which we objected to. We've been in court, the federal court, and in commission hearings, and in all those venues, NUHW has been vindicated. I mean, even to the point where in this last election that we had, the federal judge in the National Labor Relations Board found that Kaiser and SEIU had colluded in the last election to render the election impossible to be fair for employees or union members to have a free choice. And so therefore threw out the first election, and thus here we are having another election again. One thing that we've noticed that because of the concessionary bargaining that SEIU has allowed to happen with Kaiser, the quality of care has really gone down. We're not even operating at safe patient staffing levels anymore. So patient care has been cut back, services have been curtailed, and this is why Kaiser is making record profits. I think I just read in the CNA investigatory piece where Kaiser, which is nonprofit, has hired 4 Wall Street firms, paid them over $96 million, and one of them is Deloitte and Touche. And these 4 law firms are mainly to help manage for-profit organizations. Kaiser has made a lot of money. Over the last 6 years, they've made over $8.2 billion. No one knows where that money's going. But we do know where it's coming from. They're doing it at the expense of reducing pensions, retiree health care for employees, cutting down on staffing, reducing patient services. And that's how they're doing it. And our union, despite complaints by union members and asking and begging our union to file grievances, has turned the other way.
And why don't you talk exactly about what kind of concessions they demanded from the members, or what does concession bargaining mean?
Concession bargaining is whatever benefits that we have right now that are being given away, are being rolled back. Let me just tell you one example, which is on the pension. So Kaiser was able to acquire a 15% reduction on lump sum and pensions, from SEIU, which saved them millions of dollars, which they later put into the pension fund for their executives. Number 2 is, in the year 2017, they're going to cap the retiree health plan for all the retirees. Now, when we were hired, we were told that you give Kaiser 15 years, and when you reach age 65, qualify for Medicare, that your Medicare will, your health care will be taken care of. Now they want us to go back and pay for that, and they want to go back to the year 2000 to those retirees and force them to pay. And on top of that, they want to cap the amount of money that retirees are going to receive. Now, here's how they're going to do it. In 2014, when the SEIU contract expires, and by the way, SEIU has already agreed to this, Kaiser's going to take all the retirees and all the money that is being used to fund their health care, retiree health care. They're going to add 5% to that. Okay, so then that's the money that's going to be in the account to use for all retiree health care benefits. The problem with that is that health care is going to continue to rise, and the number of retirees is going to continue to grow, which means then these retirees are going to have less money to use for health care. On top of that, what's going to go away, retirees usually always enjoyed the same co-payments, the same emergency room visits, the same doctor visit co-pays that regular employees enjoyed. Now all that's going to go away in 2017.
what has been the role of Dave Reagan? Where did he come from, and what's been his role as president of SEIU?
Dave Reagan, I believe, came out of, I believe he ran an SEIU union in Ohio, I believe, and then he stepped down from that because of voting irregularities down in Nevada, where the federal government was investigating him. Then he was moved to Washington, D.C. to be under Anna Berger, at that time the Secretary-Treasurer of SEIU. And I guess they were protecting him. And then all of a sudden, after the trusteeship, they brought him out here to head SEIU UHW. And since then, you know, things have atrociously gone downhill. I mean, Dave Reagan has alienated the San Francisco Labor Council, the California, Democratic Central Committee, pretty much everyone around him. He's really alienated them, because he works like the old style union boss thug, and nobody appreciates that. And he doesn't understand that employees need to bargain their own contracts locally because it matters where they are. But he doesn't understand that. He's just looking at bottom line. And by the way, since his arrival, he's given himself a really hefty $75,000 increase in his salary. While at the same time, he's not putting any money in for any arbitration cases, to hire any more representatives to represent union members, which is one of the biggest complaints that we have now. And since the last election, we're not able to file any grievances or anything like that, or complaints, because shop stewards refuse to file grievances on our behalf.
And why is that? What do the shop stewards say?
They're just said that they're told that they're not to do it because we don't have a grievance.
Isn't that failure to represent?
It's failure to represent, but pretty much how they get around it is they're saying that, well, we reviewed it with the Steward Council, and the vote came down from the Steward Council that you don't have a grievance, which has led to multiple unfair labor practices filed by employees with the National Labor Relations Board because our own union won't represent us.
And the situation of the attack on hospital workers, healthcare, do you think that this is part of it with what Kaiser is doing?
Well, yes, it is. I mean, it's in line with the four top management groups in Wall Street that they hired. I mean, their purpose is to maximize profits, and the way they do that, and you've seen it across the country, they do it by reducing staff, reducing services, anywhere they can. They don't need to do it. And one of the things that was interesting in one of our negotiations with Kaiser said, we don't have to do all these takeaways and pension takeaways and benefit takeaways, but SEIU bargained this with Daughters of Charity. They bargained this with, all the other hospitals, okay? And since they bargained that and had these takeaways, we wanted too. And so SEIU is really the culprit in this, and is really at the meat of this whole thing. Is it because if SEIU's concessionary bargaining, all the other hospital corporations want the same thing. But even by Kaiser's admittance, they don't have to do it. They're just doing it because they want to do it.
Well, how much do the executives of Kaiser make? Are they well paid?
Well, George Halverson, who's about to be leaving on a great golden parachute, has 8 pension plans. $9 million a year, and no telling what the parachute's going to look like. So in this past, after this past campaign and contract negotiation, all the major executives got $1 million raises and improvements to their pensions. And the reason why they got that was because they took it away from our pensions. On top of that, all the managers received double bonuses. And one of the reasons why they received double bonuses, which we found out from managers from the inside who support NUHW, was that they were told that Kaiser was going to put an austerity program out, that we're losing money and we can't afford it with Obamacare. Obamacare's terrible, and we're not going to get enough money from Medicare. So you're not going to get a bonus, but we're going to give you a double bonus this year to make up for what we're not going to give you next year. So, I mean, I think it's pretty critical that Kaiser's not going to Obamacare when Obamacare, when Kaiser was the model that Obamacare went after as an HMO.
And why don't you talk about this affiliation with CNA and why that happened and what does it mean for you?
Well, here's the thing. I mean, the level of care and patient safety has gone down. nurses are very vehemently opposed to those kind of reductions. On top of that, Kaiser's going through what Wall Street likes to talk about de-skilling. In other words, they're saying that they have too many skilled workers and they want to de-skill that because obviously these workers cost more, and they want to make sure that they get other workers of less skill to be able to do this work. It's a trend that's out there, it's pretty obvious. No one's trying to hide it. That actually happens, right? So California Nurse Association just doesn't like to put their patients in jeopardy. They realized that with SEIU, they couldn't go to SEIU and ask for help since Dave Reagan tried to repeal in Sacramento the safe patient staffing ratios during meal times for nurses. And at the same time, he was shooting his own union in the foot in the East Coast because they were trying to get the same kind of safe patient staffing ratios for their own nurses in their own state. And so it was quite hilarious, but quite serious. So California Nurse Association decided that the only union that really demonstrates that they care for patients and they care for their employees and union members was NUHW. And so Roseanne DeMoro sent a blistering letter to Kaiser saying that you are not going to continue to put our patients in jeopardy. And so they affiliated with us, and the impact has been tremendous. I think this time around in this election, statewide, I mean, the numbers that we're getting are tremendous. And I think one of the big differences now with all the union members now is that in the last election they were afraid. They were terrorized. And even the judge said that the level of terrorism and fear tactics that were employed by Kaiser and SEIU was deplorable. This time around though, employees and union members are resolved. They're angry. They're not listening anymore. They want the election. They want a new union. They want a union that they can have a voice in. And it looks like we're going to win this one. And was that at the time, NUHW had won representation, for several chapters of unions in Kaiser, Southern California, and subsequently won it here in Northern California too. And so Kaiser represents, NUHW represents union members in Kaiser, at least a portion of them. Now what was happening during the campaign in the last election was that SEIU was telling everyone that if you change unions or vote for NUHW or join NUHW, that you would lose your contract, that you would lose your bonuses, your raises, all those things, promotions, which everybody knows that it's against the law. The contract is a contract regardless of what union you join or comes in. What Kaiser did was that Kaiser intentionally withheld the bonuses and raises that were contractually obligated to give to those workers or those union members that are joining NUHW. They intentionally did that in concert with SEIU during the election, thus giving the impression that SEIU was telling the truth. And so that scared a lot of union members, and so they decided to vote for SEIU because they thought they were going to lose their contract. Today, they know that that's a lie. So that's how Kaiser helped SEIU.
And what does the SEIU leadership represent for labor if labor continues to follow those kind of practices?
Well, if SEIU continues, then I don't know really how long unionism is going to last in this country under the principles that it was founded on, which is unions are union members. We're going to see corporatized unions to where you're going to make concession bargaining to satisfy the boss just for the sake of not having to fight the boss when they open up new establishments to get new union members strictly for the collection of dues, not to represent them. I think it will be the downturn in unionism in this country, and it certainly will give the right to work states a lot of ammunition to maintain their right to work attitudes and laws.
And this whole idea of business unionism, this labor management partnership, why don't you talk about that at Kaiser, what that's meant?
Well, I think the partnership was a good idea at the beginning because there was supposed to be an equal sharing of decision making and workforce structures and things of that nature, which it was nice, right? But now Kaiser has pretty much taken that away from the union members, like in workplace safety, which is one of the partnership ideas that came up and was working. Kaiser developed that and put it into their business plan now. And so they control it, and thusly, what's happened now, we have no workplace safety to speak of. The partnership
What does that mean, no workplace safety?
Well, I mean, we're supposed to be having workplace safety committees that meet every, periodically to discuss and act on workplace safety issues in the departments, but we don't meet. On the other hand, unit-based teams, which is supposed to work out organizational and workload issues in the department, we don't meet. It's all top down, and it never was supposed to be like that. Even the principles of the partnership say that there is no top down from the employer, but that's the way it's operating. So the partnership is a complete failure. CVS Pharmacy, which is doing exactly what Kaiser is doing right now, and what they're doing is like this. An example: they'll look at an employee and say, hey, you know what, you're overweight. Okay, so you need to lose X number of pounds, and if you don't sign up for the program, we're going to charge you an extra $50 a month on your health plan. That's what they're going to do. This is exactly what Kaiser wants to do. Okay, so we feel that that's not Kaiser's business to force anyone into any type of program. It should be voluntary. It's also private. But that's what they're doing because they want to make sure that they can tax pretty much employees for pre-existing conditions, which, for Christ's sakes, Obamacare doesn't even do that anymore. But that's what they want to do. So they're going to charge you for a pre-existing condition if you don't take a plan. Now there's some camp to say, well, that's a good thing because employees should take responsibility for their own health. Well, yeah, but they hit the nail right on the head. Employees should take responsibility for their own health. They shouldn't be forced into it by the employer and be penalized.
Now, these wellness programs, quote-unquote wellness programs, are being pushed around the country, and apparently some union officials and the SEIU are pushing them all over in the unions. As
Exactly.
Money.
Exactly. Our union actually agreed to that and are pushing it.
And what does it mean concretely to the member?
Well, you have no control. You have no control over your health anymore. You have to do what they tell you to do, and your union won't even back you up. I mean, I'm sorry, but my health is my own personal business. It has nothing to do with my employer. But that's where we're at right now. We don't have a choice. It's getting down to where employees don't have a choice anymore. And they don't have a choice with their union. And if they complain to their union, all that happens is that they're terrorized by their union and told to shut up.
And is there a lot of terror on the job?
Yeah.
Intimidation on the job?
Oh, it still is. They go around in groups. They go around in groups and corner people and tell them, you're going to vote for us, you can't vote for the other guys and all that. It's totally against the law. Kaiser allows them to roam around, still around the hallways, but yet when NUHW members politely go around to distribute flyers, they're being chased away, or the police is called on them, or security is called on them, and SEIU calls security on them, and HR, Human Resources, comes running to the aid of SEIU and asks us to leave. I think Tony Wong, one of the HR representatives here, has even gone after the nurses since the nurses started helping us, and has gone after nurses, telling them that you can't do this, it's illegal and all stuff. But all along, the only person that's illegal is Tony Wong. It's a company union. Make no mistake about it. It's a company union. Yeah, they're right. This is the best contract that they ever got at Kaiser. What they're really saying is that this is the best contract Kaiser ever got. Besides the nurses, the engineers have joined us, the biomed people have joined us, carpenters are joining us, because they're also seeing that what we said long ago before the first election that what's going to happen is that there's a direct attack on their pensions and on their retiree health care. That people have been working here 15, 20, 30 years now, expecting to come out with a nest egg so they can retire on, now find that nest egg is in jeopardy. They don't sell insurance, they sell you membership, okay? But here's and supposedly that goes into nonprofit. But if you want to increase or better your premium, okay, then you pay that, and that becomes profit. All right. So when they in combination with the wellness program and the reduction in and the increase in out-of-pocket payments for prescriptions and doctor's visits and whatever, and there isn't an increase in salaries, then pretty much you're just working to pay for your co-pays and your prescriptions and for your membership.
What do you think about the idea that hospital workers who are working in hospitals have to pay for health care?
Well, I think it's ludicrous that they have to do that. I mean, for the longest time, I mean, Kaiser changed, you know. Somehow they got greedy over the last couple of years, but healthcare workers shouldn't have to pay for their healthcare insurance, especially with a healthcare provider like Kaiser. I tell you one thing though, is that Kaiser's been skimming a lot of edges. You know, just like for their tax exemption in the city of San Francisco. I mean, they're just barely paying the minimum in community outreach programs just so they can keep their tax exemption status, you know, viable, right? But it's pretty evident that they're operating like a Fortune 500 company. I think in the study they said that if Kaiser was a publicly sold corporation on Wall Street, that would be number 3. And on the list of Fortune 500 for profit, that would be 95. So clearly, Kaiser is not for profit anymore. They're actually churning out the profits at the expense of services, patient safety, benefits, workers' compensations, staffing, because that's where they can save the money. And rifling the pension is a lot of money. There's a lot of money in the pension, and when they rifle the pension from union members and give it to their executives to make their pension sweeter, that's just awful.
And so you're pretty optimistic you're going to be successful this election time?
I've been looking at the numbers, and I got to tell you that the numbers aren't lying. I mean, we are way at supermajority in a lot of areas where we were not the last time. And really, the last time was because we didn't have enough people on the ground to go talk to all these people. And with CNA, thank God for them that they've helped. But one of the biggest things was that we were telling everybody that this is going to happen if SEIU wins this election, and you know, people were frightened, they were terrorized, they didn't know if we were telling the truth. Now all of a sudden they found out that it was the truth, because they're experiencing it right now. You know, I guess sometimes you got to lose something to get mad enough to go back and fight for it and try to get it back. And these union members have lost a lot, and they regret it now. So I see the attitude very different, so I'm very optimistic. So optimistic that SEIU pulled out a lot of their core people here to go to other facilities where they think they still have a foothold, because we're pretty much 100%, almost 100% over here at NUHW, so they have no room to fight over here anymore, except maybe give away free food and try to convince you to vote for them.
Where are they paying for the free food?
Well, they're taking it out of our union dues, along with the hundreds of organizers that they brought in from Puerto Rico and around the state to work for them through Craigslist. They're paying for their airline tickets, their lodging, their entertainment, their gas, and their salaries, and all they got to do is convince people to stay with SEIU.
So they're hundreds millions of dollars.
It's millions of dollars going out the door here. I mean, and let's understand this. You know, Wall Street, you know, understands that SEIU is in debt at a tune of over $30 million. You know, and we know that because they couldn't even pay a lump sum pension to their own union workers. So they're in debt. That's how come they're increasing our union dues. And they're forcing us now to pay a partnership tax that belongs to the partnership, a tax that we never used to pay before, because back then when we negotiated the partnership, Sal Roselli negotiated and bargained in our collective bargaining agreement that Kaiser would pay it. Oh, and by the way, we haven't bargained our local bargaining agreement in the last 2 sessions. And in the year 2014, when the SEIU contract expires, if SEIU wins, it would have been 10 years since we bargained our local agreement. And our local agreement has to do with working conditions, staffing, seniority, annual step raise increases, workplace safety. None of those have been bargained because Dave Reagan said no.
And what is this partnership tax?
Partnership tax is to belong to the partnership, every member has to pay 9 cents per hour per member. If you work, of course, if you work double time, it's 18 cents. And if you work a triple shift, it's 27 cents. Okay?
Where does it go?
Well, it goes into the coffers of Kaiser, and my estimation is that the SEIU gets $4 million of that for organizing, which was a deal that Reagan struck with Kaiser.
So it's a tax on the members for him to organize more people.
Well, or for him to get a new sofa.
I see. If you win, what's going to happen? What's going to change?
Well, immediately we're going to hold elections to actually vote in stewards that will actually do the work. We have a lot of ex-stewards that were very highly trained that were removed because we wouldn't sign a loyalty oath to SEIU to become bad stewards. A lot of people tell me you were removed because you were bad stewards. I said, no, I was removed because I wouldn't become one. And so there's a lot of us here that we're going to run again because we need to clean up and represent our members. Then after that, we're going to go after all the contract violations, which are numerous. And it's going to take us a little while to clean up. We know Kaiser's going to play hardball, but with the nurses together with us, the potential for a major strike that may shut down all the hospitals in Kaiser in California, I don't think Kaiser wants to face that. And I don't believe that what we're asking for and what NUHW has been holding out, which is no benefit takeaways, but increased benefit takeaways, I don't believe that that's unreasonable given the amount of money that Kaiser has made. So we haven't given in like SEIU has on concessions, so we don't intend to do it now. We're going to fix it.